What are the essential focus and the main benefits of implementation research?
Yeah, when we talk about implementation research, it is basically an approach that promotes the translation of research findings and other evidence-informed interventions into routine practice. So in this no-do journey, we normally ensure that the evidence-informed intervention is relevant, that it is feasible, it is acceptable, cost-effective, and sustainable. We also look into the willingness of the people to adopt it and to correctly deploy it, as well as whether it is reaching or whether it will reach the target population equitably. So these issues that I've mentioned are normally referred to as implementation outcomes. They are basically intermediate outcomes between in the translation of the evidence-informed intervention to the desired outcome. Also in this no-do journey, we identify and remove obstacles to the successful implementation of evidence-informed interventions. So essentially in implementation research, what we do is to take knowledge on what works and make it work in our own setting. So now talking about the advantages of implementation research, the emphasis of implementation research on contextualizing issues, on domesticating interventions is of great importance because it encourages the achievement of implementation outcomes that I earlier mentioned, as well as when we get to the area of scaling up evidence-informed interventions.
Why is implementation research important for the health systems, particularly in low and middle income countries?
The low and medium income countries are in general resource limited settings with complicated health systems, and complicated in terms of the different levels that there are, complicated in terms of the resources, the varied resources that are available at these various levels, and also in terms of the infrastructures that are available, as well as the skills that are available at these various levels. So an homogeneous kind of application will not work across the settings. So we actually need an approach that will deliver all the essentials of the intervention that will make it work in the various contexts that we have, in spite of the challenges or the limitations that we have in this context.
Why is it important that IR team understand the missing skills among team members?
Of course, nobody knows it all. And I think that is why it is important, and it is actually one of the beauties of implementation research, that you work in a kind of multidisciplinary and interdisciplinary team, so that the team members are able to complement each other, in the areas. They're able to leverage on the strengths, on the knowledge, on the skills of other team members to still get the work done. Of course, depending on what they are doing, when the team is being constituted, it is important that these various issues are put, on the table and taken into consideration, even in the constitution of the team members. So usually those are things that we take care of at the beginning to ensure that the various skill sets that are needed to deliver that particular evidence-informed intervention are actually, put together and are present, in at least a team member, so that we're able to get the job done. And of course, in the course of implementation, or in this course of planning, we already know who we do what, and we know who we assign what to. And at this stage, the planning stage, we will even be able to identify if for whatever reason, for whatever omission, there's no particular skill set, in that team. We would have identified this at the planning stage, and we are able to make amends before we really go out to start implementation.
What type of skills are required for an IR project?
Of course, we must have somebody that has the content knowledge of the evidence-informed intervention that we're talking about. The content knowledge has to be there. For instance, if we are looking at maybe a TB intervention, or we're looking at an HIV intervention, the person with the content knowledge has to be on the team. In addition to that, we talked about some of the focus of implementation, which is in terms of being able to systematically look at issues, being able to contextualize issues. So we also need somebody that understands the context within which the evidence-based intervention is to take place. That will also be very helpful in terms of the formation of the team. Then we will also need people that also knows about the various approaches, of implementation science, the frameworks, the implementation outcomes, how we go about measuring the implementation outcomes of how do we assess acceptability, how do we assess feasibility of the evidence-informed intervention, how do we see, how are we able to measure, or if the intervention is being correctly deployed. That will be in terms of fidelity, or what we call adherence. How will we be able to look at cost effectiveness, and so on and so forth. So we need people that they have the know-how of how to look at these various implementation outcomes. It is also important, when I talked about the framework earlier on, for instance, let's say we want to look at barriers or obstacles in the course of implementation. It is also important for us to be able to look at this within recognized frameworks, so that things are done in a kind of structured way, and also comprehensively so, not just haphazardly done. So people that are familiar with those frameworks, with the models, with the possible the determinants, that factors that can affect what we are doing, maybe at the system level, at the individual level, the healthcare level, the intervention itself, and so on and so forth. It is important that we have also those kind of expertise.
What is the significance of IR in advancing evidence-informed interventions?
Okay, let me just say, not necessarily to the young scientists, but maybe to the implementation research fraternity, to just dwell on what I will say the not widely used concept of implementation research. And I will say that maybe that starts from the fact that translation of research findings and, of course, evidence-informed interventions into routine practice normally take time. And that as things are, we have not achieved the critical mass in terms of skilled people that know about implementation research to move the agenda forward. Of course, that means that we still need many more people, especially the young ones, or no, not necessarily young, the new people that we enter the field. And of course, we know that the approach is still relatively new, and it requires more time for it to be known, for it to be adopted, for it to be, to take root. Okay, So, and as a result of this, the rollout of evidence-informed intervention still continues to be done, in a kind of random manner. I would say, okay, for instance, we still get the rollout of intervention being based on, policy directives, or maybe in a kind of emergency. They are not so structured as we will have it in implementation science, implementation research, looking out for the implementation outcomes, adapting the adaptable ones into the existing context, as well as identifying and removing barriers in the course of implementation. So, and I think there's an opportunity here for, let's say, WHO and other bodies that actually recommend health packages to countries, that maybe they can start, embedding implementation research approaches in the introduction and scaling up of these packages.